ago, a nurse in San Antonio, Texas, shares with Eagle News how frustrating it is for healthcare professionals to face the shortage of personal protective equipment and how they are adjusting to the situation. Let's hear it from Stephanie Ward.
Hello, everyone. My name is Stephanie Ward. I'm a nurse from San Antonio, Texas, and I come from a family of nurses. Both my parents work in one of the hospitals here, and one works in another clinic. I work in a telemetry unit, or a cardiac unit, if you will. So my responsibilities include passing out medications, doing assessments, making sure that my patients are okay, as well as little things like if they need something, they usually ask us or some of our nurse aides. Since the outbreak, our work has changed in the sense that we are running out of supplies. We don't have a lot of the things that we need to protect ourselves. We've had cases where family members would come and go onto different units just to find masks and take those home. So right now, on our unit, we have an assigned mask for each nurse, and we have to make that mask last because we don't have a lot. So workload-wise, we didn't really have that much of a change. The only thing that we've noticed is that there's a lower census, or that basically just means we have less patients. There's less of a patient load, but we're still doing a lot to make sure that the patients are okay, given that we are low on supply for a lot of things, even with some medications, I feel like. But other than that, well, what we've been told is that it's more like the calm before the storm. We're anticipating that we'll be getting more coronavirus patients coming into our unit or into our hospital, actually. So we're anticipating that it's going to get a little worse from here on out. Normally, I wake up at 5 o'clock and I come home at around 8:30, sometimes 9. So I'm working more than 12 hours every time I come to work. It's not easy because it's very taxing. Before, we would have family of the patients who would kind of add to that stress. But now, because our hospital has implemented this new policy where we don't have any family members come to visit any of the patients, it's been a little less hectic because there's less, I guess, interference or less friction between family members, patients, and the nurses. But we do still receive a lot of phone calls, and a lot of patients' family members are still trying to come in and and bypass all of the security measures that we're implementing to make sure our patients don't have as much exposure. But what keeps me going, though, is I get to see my patients improve. I like to see them get better. But the downside to not having any family members is that most of the patients don't have that support or emotional support that they get from their family members. That's one of the biggest downsides that I've seen. The most challenging things that I see every day is just trying to get the patients to calm down, or to get them to understand your standpoint, if you will, because they get agitated, especially now with what's happening. They're afraid of the spread coming to them. In our hospital, we already have 3 confirmed cases, and the doctors, I understand they're fighting really hard to try and get the nurses the proper protective equipment that we need. But what I do personally to stay calm, I like to talk to my coworkers about it. We make jokes, nothing inappropriate though, just work jokes. And when I come home, I always listen to music, stuff that calms me down. I like to decompress in the car. No talking, no phone calls, just me and my music. That's what I personally do. Or sometimes I just nap, when I can. So the way I help others stay calm is we usually, for the most part, we have the same strategies. Me and my friend group, we like to listen to music together, or sometimes we'll FaceTime, or we'll play games on our phones. That helps. But for those in the healthcare system, my advice for you guys is to make sure that you're always protecting yourselves. Always wash your hands. That's very important. And to advocate for yourselves. For my unit, initially, just this Tuesday, we weren't allowed to wear our masks if we weren't going into a patient's room that required us to come in with a mask. We weren't allowed to wear our masks if we were going to another patient's room and that patient started coughing just to protect ourselves. We weren't allowed to do that. But on Friday, we got a new message saying, hey, we're supposed to wear masks now, regardless of what the patient has, wear your masks. But that's because we advocated for our safety, and because we had people, other people in the professional healthcare field backing us up. So advocate for your safety. That's really important, given that we have an outbreak right now as well. So again, I'm in San Antonio, Texas. Stephanie Ward, Eagle News, and right now we are living in interesting times. Stay safe, everyone, and don't forget to wash your hands. Back to you in the studio.